Hello, my name is Carlin Luby, and this is my presentation on the Week 1 topics. This is the note card that I have. It's just a list of the required information, and the back is blank. Okay, so when we're talking about disease, we're really just talking about an illness that's causing physiologic dysfunction within the body. An example could be pneumonia, or it could be something like diabetes. Disease can really be an acute problem, or it can be more of a chronic problem. It could be something that you've acquired, or it could be something that unfortunately you were born with and now you have to deal with it for the rest of your life. Additional classifications of disease could also be related to what organ the disease is impacting. So it could be a cardiac disease or a gastrointestinal disease. Often a disease might only impact one organ within the body. However, it could also really be more of a systemic problem impacting your whole body. When we talk about disease, we're also typically looking at what the cause of disease is, and that's called etiology, the cause of a disease. So for etiological discussions, we're typically talking about etiological factors. So that could be a biological factor, such as bacteria or a virus. It could also be a physical cause, like a trauma. Then you have chemical factors, like a exposure to a poison, or it could be from too much alcohol. You could have a genetic cause, or it might be related to nutrition, whether it's a nutritional deficit or a nutritional excess. Nutrition can also have a large impact on the body. However, when we're talking about the cause of disease, it's not typically from just one of these factors. Often disease is multifactorial. And when we're talking about the causes of disease, a lot of times we're talking about risk factors. It's a number of different things that are really predisposing you to disease and may end up leading to disease if not addressed. Often etiology is confused with pathogenesis, but they're two very different things. Pathogenesis is actually referring to the process of how disease is evolving within the body. So when we're talking about pathogenesis, we're looking at what's happening at the cellular and the tissue level within the body after you've been exposed to that etiological agent. So an example here would be coronary artery disease. The pathogenesis here is actually the progression of the inflammatory process of fatty streaks leading to occlusive vessel lesions within the vessels of the body. Often atherosclerosis is cited as the etiology of coronary artery disease. However, that's inaccurate. They're two different things, and the etiology of coronary artery disease is actually still uncertain. So after a disease manifests within the body, a patient will typically present with a list of signs and symptoms. So these are really the structural and the functional changes that a patient is experiencing because of a disease. When we talk about symptoms, these are really the subjective complaints that a patient has about the disease. So it's something more like dizziness. And then a sign is something that's a little more objective, something that a provider can observe from a patient. So it could be an elevated temperature or something like a dilated pupil. But the provider is going to take all of this into consideration, and sometimes just a compilation of the signs and symptoms that are really characteristic of a disease state will be considered a syndrome. And something like that is an example would be chronic fatigue syndrome. But your provider is going to take all of the signs and symptoms and the possibility and probability of different diseases into consideration to hopefully come up with a diagnosis for you. And that's really just a designation or an identification of the disease is the diagnosis. So it would be that your provider tells you you have bacterial pneumonia, for example. And in order to arrive at these diagnoses, a provider is first going to take your history. They're going to try to understand what the progression of this disease has been for you. And they're going to do a medical exam where they take a closer look at you. They're going to listen to your lungs. They're going to palpate your abdomen and try to really get a better understanding of what's going on. Finally, they're probably going to order some diagnostic tests in which they can try to validate or confirm what's going on. maybe look at something that they can't see just by looking at you or listening. When we're talking about diagnostic tests, the diagnostic tests are really lab tests like blood work, or it's imaging like an MRI or an ultrasound scan to get a closer look and give additional information. Again, this is all meant to validate what the provider is thinking. But when you get the results of these tests, you need to take a look and interpret whether or not the result is normal or is it abnormal. And a normal lab result is really just something that falls within the bell curve of that 95% distribution. Often, normal ranges are adjusted slightly in order to take into consideration gender or age or other comorbidities. But it's also important to consider when you look at the results of these tests, what's really the reliability and the validity, or the sensitivity and the specificity, and really the predictive value of these tests, because you don't want to just rely or base your diagnosis on a test that is really inaccurate and not giving you a full picture of what's happening. After you get a diagnosis, your provider will typically talk to you about your prognosis, and that's really the outcome that could be expected with this disease. So that might be, for example, you're most likely going to have a full recovery. Or it might be, unfortunately, people with this disease only live another year or two. But this discussion is typically had while you're also talking about possible treatments for this disease or complications that might happen. So complications are really the adverse outcomes that could happen because of this disease. So an example here would be you have diabetes, and typically patients may end up experiencing neuropathy because of their diabetes. But it's important that providers really talk to patients and make sure that they understand what the prognosis for this disease is, what are their options, what kind of treatments are available, what are the risks and the complications associated with those, so that a patient can really make an informed decision about how they want to treat this disease and what they can expect, just so that they're educated and can live hopefully a full life continuing on with this disease. But that is everything that I have for this week 1 presentation. Thank you.